here I am trying to make an impassioned plea to all of you to open up your hearts and your minds, and more importantly, your practices, to young people who are struggling with this issue. And as I do that, there are often two outs that come. There are two escape routes that emerge. One is, will I ever see it? You know, what's the prevalence? What's of this concept, of this phenomenon? And the numbers that are generally accepted by WPATH, the World Professional Association of Transgender Health, says 1 in 12,000 males, roughly 1 in 30,000 females. And this is based largely on those who have undergone sexual reassignment. So these numbers are felt to be probably a significant underestimate in terms of population epidemiology. Other scientists, such as Ole Sager and Conway in 2007, they mined the data further, and they came up with figures that are at least 1 order of magnitude lower. So more prevalent by 10 than would have been suggested by WPATH. Looking closer to home in Toronto, this is numbers that come out of Zucker's clinic, and he shows that over the last 30 years, there's been a significant increase. The upper line is children, the lower line is adolescents, in terms of the number of referrals made to their center for young children who are gender variant. And boys tend to be more commonly referred than girls. So you will see it, or you will possibly see it. I currently have about 4 patients in my practice. The other out is maybe it's just a phase, you know, and parents use that, you know, maybe like we'll wake up one morning and it'll all be gone and we won't have to worry about it anymore. But also there's a potential for us as providers to use it. Maybe it'll just go away. How do we know it's real? And if it's not real, why should we focus on it? And maybe if we don't focus on it, it'll go away more quickly. It is true that the majority of children who present with transgender do not, as adolescents and adults, remain GID, gender identity disorder. The majority of them actually will have a homosexual orientation once they mature their sexual identity. And this has been shown in a number of studies. However, it would be very helpful if there was some way of predicting which of those children would in fact persist with a diagnosis versus those who would desist. And the reason that it would be helpful, because then we could apply earlier intervention. As it stands now, although we know that those who present with symptoms that are more intense are more likely to persist, it's not sufficient for us to really discriminate and to intervene earlier. Some people would also suggest that using the puberty as a stress test is also helpful diagnostically. So by measuring the amount of discomfort that a young person experiences as they begin to go through puberty, we could further corroborate the significance or the intensity of their situation. In contrast to children, adolescents who present with gender identity disorder are more likely to persist. So in these studies, approximately 2/3 of those who originally presented will persist and move on to sexual reassignment. This suggests that there's a lesser plasticity in adolescence for children. And plasticity is a bit of again, another one of those traps, because it has led some people to saying, well, okay, if children have a degree of plasticity, then it's our job to work really hard to stamp out any suggestion of cross-gender behavior or thought so that we rescue them and we make sure that they're, that this issue disappears. That approach has been applied, it has been instituted, and it's not only is it wrong, but it's also very damaging. And then the other issue is to say, well, if there is plasticity and they will perhaps desist, not persist, but desist, then maybe we should just wait. And again, I would make the point that young people who present with these questions around their gender identity require assistance. We need to involve ourselves without necessarily changing their gender. We need to help support them as they go through the process of consolidating their identity, whichever way it goes. They will benefit from our assistance. So let's not just sit back on the sidelines and wait. So as healthcare providers, It's our obligation, ethically and professionally, to understand that transgender is biological and not a matter of choice. We need to be inclusive in all aspects of our work, so we create safe and nurturing environments, allowing all of our patients, not just transgender, but all of our patients to feel welcome and validated. We need to communicate our recognition of gender variability so that the young person has at least one place where they can pose their very difficult and important questions. Consider this, a simple questionnaire. You go into Dr. X's clinic and you say, well, just please fill in this, and the doctor will see you in a moment. Name, phone number, gender. Consider how refreshing it would be if that questionnaire looked like this. Name, preferred name, because people who are struggling with gender may not want to be called by the name they were born with, but may want to have a gender that's more commensurate with the way they see themselves. Phone number, preferred method of contact. This respects confidentiality, not for just this population, but for everybody. And in terms of the gender line, giving some demonstration, just on a questionnaire, that your practice is open to gender variability. And what about considering the question, some young people struggle with gender. Is this an issue for you? As part of your questionnaire, part of your screening questionnaire. The vast majority of young people, when you ask them this question, will say no, it's not an issue. But for the one or two young people for whom it is an issue, this might save their lives. Furthermore, as healthcare providers, we must understand and respond to the threats to health that are inherently experienced by those with GID. I alluded to those earlier. And we must respectfully and compassionately refer to other providers if this is an area that is personally too difficult for us. So it's not a problem to say, you know what, this isn't something I can deal with. But in that case, we must hand over to somebody who can. My working with these youth has really helped me to grow and to extend my comfort zone. These young people are adolescents first and foremost, and they are struggling. A positive developmental approach that focuses on building competence, confidence, and most importantly, social connectedness can promote resilience and healthy development. As providers, this is a vital role that we can play in optimizing their outcome, but only if our practices are inclusive and safe. These issues are complex and multifaceted.